Welcome to MIUA 2020. My name is Kwan Ho, representing City University of London. Today I'm going to present a collaborative work with University of Exeter and the Royal Devon and Exeter Hospital titled A Machine Learning Approach for Colles Fracture Treatment Diagnosis. To begin, the team behind this work includes myself, Professor Arthur, and Dr. Carlos from City University, as well as Associate Professor Karen from the University of Exeter and Dr. Andy from the Royal Devon and Exeter Hospital. The agenda for this presentation includes a brief introduction of what Colles fracture is, what is our data source, and a brief summary on our image preprocessing steps. I will also summarize some of the key highlights for our model construction and the corresponding analysis. Lastly, we will conclude our finding from this work, as well as our plan for future investigation. We hope that this work can achieve the following three things. Firstly, to validate findings from a previous work where it shows swelling and texture features are important for determining Colles fracture treatment. We'll use this learning to construct an appropriate predictive model using machine learning, and subsequently to derive further learning from this work and apply that for our future investigation. What is a Colles fracture? A Colles fracture is a common type of wrist fracture at the radial bone that will cause a posterior displacement of the distal fragment. An example is shown in the image on the right, where the blue arrow is pointing at the fracture. Typical treatment involves either a manipulation under anesthesia at the emergency department, or if the fracture is more severe or unstable, surgical treatment such as open reduction and internal fixation will be applied. A good diagnosis for appropriate treatment will not only save the patient repeated visit to the hospital, but also reduce inefficient use of hospital resources dealing with the failed cases. In this work, we will utilize a small dataset of X-ray images from 139 cases of wrist fracture and 22 health controls, making a total of 161 cases to classify the appropriate treatment using machine learning. An example of the raw images can be seen in the bottom left, where you will observe a wide variety of wrist orientation, as well as the presence of other noisy information, such as the lines of collimation. The X-ray images can be categorized into 5 key groups, from images of healthy controls to pre- and post-manipulation treatments with various degrees of success. The distribution of these categories, which will subsequently be forming the model's class labels, is as shown on the top right, and this is assumed to be similar to the case distribution in a typical workflow at an emergency department. Successful here in these categories defines the cases of manipulation being performed successfully with no further treatment required. On the other hand, unsuccessful refers to cases where further surgical treatment was recommended after manipulation but not yet performed. Post-treatment cases are included in this work as separate labels, as is assumed a batch of images to be diagnosed will include these conditions. This can, however, be easily filtered retrospectively when necessary. All the raw X-ray images are pre-processed by firstly identifying 3 landmark points manually, as shown in the images below. as the blue, red, and green dots. These landmark points are used to reorientate the wrist such that the radial bones are aligned vertically. Subsequently, lines of collimations are removed. Once the images are processed, various measurements to indicate the wrist swelling, osteoporosis, and texture conditions at the radial bones are generated. The detail and the rationale behind these measurements can be found in the reference paper listed below. And in this reference work, swelling and more significantly, texture features were found to be important for Colles fracture treatment classification. A total of 36 features are identified and split into 4 main feature groups, including basic patient information, the indicators for swelling, osteoporosis, and texture at the radial bone. These features will be used as the input for all machine learning models to be presented in subsequent slides. Prior to the model construction, exploratory data analysis are performed from univariate correlation with the 5 classes to the cross correlations between all the different features. Among the features, some of them, such as the local binary patterns, are more capable of separation between classes on their own. In addition, in the cross correlation plot on the right, where I box out the 4 feature groups, it can be observed that intra-group cross correlation are high, while intergroup are relatively low. This will be very useful in subsequent work to identify the important feature groups in classification during future investigation. During model construction, oversampling is applied given the very small dataset we have. For each class, sampling is conducted with replacement to mimic the sampling from a population, while the overall distribution of the 5 classes is maintained. To ensure a consistent comparison between models, the same random seed is applied during training and validation set split, as well as model training where applicable. Tenfold cross-validation is applied to each model to account for the variability of the training data. This allows for a better gauge of the model generalization and the overall performance of each model. 3 models are used in this work, namely logistic regression, decision tree, and random forest, which is primarily an ensemble of multiple decision trees. Logistic regression is chosen as a base linear model, while tree-based models are chosen because of its relatively easy model interpretation. This is useful for us to identify key areas for future investigation. For example, we can narrow down to a particular leaf node, as shown in the plot at the bottom left, to determine what has been separated and what further separations can we achieve. The performance of the models is presented in the plot at the top left. Logistic regression did not fare well, given that the classification may not be a linear combination of the features selected. In contrast, tree-based models handles the nonlinearity with significantly better performance. Further boost of accuracy can be achieved using random forests, but at the expense of the loss in some of the model interpretation. The effect of feature groups is also evaluated using a random forest model with all included feature inputs as the base model. It can be observed that using the same random forest model, but with only specific group or subgroup of features, such as swelling or only local binary patterns, will provide a suboptimal prediction performance. This is likely due to the missing information from the omitted features that will be needed for accurate prediction. The use of texture features will provide an on-par prediction with the base model, but with large variability during cross-validation. The best performance can be observed when useful supplemental features from the swelling group is added to the texture features during model training. This has not only improved the model accuracy, but also reduced the variability. From the finding, it can also be deduced that other features from other feature groups might not be as significant in the classification and may even hamper the model performance, as the inclusion will reduce the chance of selecting the actually most relevant features during the construction of the random forest. As a conclusion, we have validated that the indicators for swelling and texture at the radial bones are important for Colles fracture treatment classification. Three base models have provided a viable predictive model for this task with good accuracy and interpretability. Lastly, given the importance of these texture features, it will be interesting to apply a convolution neural network in a similar classification task as future work. Before I end this presentation, I would like to thank our collaborating partners for their valuable medical advice and their validation of our work in this project. Last but not least, thank you for your attention and have a good day.